Everybody, welcome to the GMAT Ninja Podcast. Today we're talking with neuropsychologist Dr. Ari Hall from College Psych Eval. And we're going to answer the question, can you just pop a pill and get better at taking tests like the GMAT, GRE, or executive assessment? And we'll start with things like Adderall and Ritalin. We'll get into different kinds of supplements, things like omega-3s, caffeine, amino acids, and finish up talking about beta blockers and what to do if you feel like your brain functions a little bit differently. Ari, before we get started, what is the obligatory thing we must say?
First of all, thank you for having me on today. And the obligatory thing we must say is that what we're telling you today is for informational purposes and does not constitute medical advice.
Okay, so one of the things I hear about all the time from students, when I was an undergrad, I took Adderall, I took Ritalin, and it really helped me focus and it really helped me study. And now they want to apply it for something like the GMAT. So let's get started with those. So tell us a little bit about Adderall, Ritalin, that class of drugs. What are they for and what do they do?
Yes. So Adderall and Ritalin represent the two major classes of stimulant medications typically provided to people who are diagnosed with ADHD. So Adderall is an amphetamine-based medication and Ritalin is what we call methylphenidate. And in different ways, what they're doing is essentially just acting on chemicals in your brain, such as dopamine or norepinephrine, and they're modifying the amount of those chemicals available to you so that your brain can lock in to what you're trying to do.
So for somebody with ADHD, how exactly does that work? How does that help them focus better on an exam? So it sounds like it's kind of cutting out some of the noise in their head that would distract them from the task at hand of taking the exam?
Yes. Yeah, exactly. I mean, if you think of, for instance, you're listening to someone lecture at you even, or listening to a recording, right? Then the recording or the lecture is the signal part. And then the noise is any little thing you might hear or see in the background. And so what these medications do is they essentially try to reduce that amount of noise so that you can zone in more to whatever your task is.
Okay. So pretty obvious for somebody with ADHD when there's all this noise in your head as you're trying to focus on this question in front of you on the GMAT or GRE. And there's so much of that noise that it makes sense to take something like Adderall or Ritalin, cut that noise down, you can focus on the task at hand much better.
Yes.
But that sounds great for all of us, right? We all struggle to focus. Like I would love to be laser focused on my GMAT exam when I sit there and take it and have no other distracting thoughts. So is it a good idea for people without ADHD? Doesn't it help them as well?
It might, is the short answer. It might. But honestly, the evidence is mixed on whether these medications help or are just kind of more harmful. And by harmful, I mean like if they just kind of get in your way in terms of focusing and doing these tests. Because these medications, while they're meant to reduce that background noise that we talked about, they're not going to put the knowledge into your brain. They're going to help you be able to access your knowledge and all the prep that you've done much better, but they're not, for lack of a better way to put it, they're not going to make you smarter.
Fair enough. Does it also change how you end up thinking? And where I'm going with this is we've had a number of students over the years who say, hey, look, I took Adderall, people without ADHD who say, hey, my friend gave me some Adderall when I was an undergrad and I could sit there and I could study for 18 hours for my chemistry exam or my economics exam and it worked great for me. It helped me do these amazing marathon study sessions. What I think I see out of those same students who say, well, now I'm going to try it for the GMAT, and they start either a study session or a mock exam or an actual exam. And I find a couple things can happen. One is they get really jittery and then they have a harder time focusing. The second thing that's almost more common is they seem to struggle with flexibility at that point. And it's they will look at a question and they'll think of, let's say it's a math question. And instead of thinking broadly about different ways to solve it and trying to find the best tool for solving it, they'll get really tunnel visioned and narrowly focused and just barrel down a single path. So I guess my question for you is, does that sound consistent with your understanding of how the drugs work, that for somebody who's using it off-label, that kind of that hyper focus or that trimming of the noise might make them either less flexible or just too jittery to really function?
Yeah, that's an excellent question. And there is evidence to suggest that by virtue of how these medications work, they can kind of get you too lasered in to, let's say, one or a couple particular things, such that you're losing sight of the overall picture, let's say, which may be to get the test done in the allotted amount of time. Also, because they're stimulant medications, think like caffeine is a stimulant, right? These are prescribed stimulant medications. They have the potential to impact one's sleep, which wouldn't help your alertness and your focus for, let's say, the test day the next day. Or they can make some people feel more anxious, which is, again, something that wouldn't help. So there are essentially multiple factors that go into whether or not these medications are actually helping somebody, or if that overcorrection, so to speak, and becoming too focused on one particular aspect is going to end up benefiting you in the end.
And would it be an oversimplification to say that, again, for non-ADHD brains, again, for people using Adderall or Ritalin off-label or some similar stimulant, that it's going to make it harder to multitask, harder to kind of split your brain into sort of different pieces? For example, on the GMAT or the GRE, you're trying to manage your time while also trying to think of different good ways to solve a problem. It's a form of multitasking. Is it fair to say that those sorts of stimulants can make that more difficult?
I think it's fair to say that those medications can make it more difficult, as long as we're also thinking about the fact that there are other factors involved too. But if we're thinking that, especially if used off-label, that these medications are kind of locking people in too much, or just narrowing their line of thought, so to speak, then it's quite possible that we can sort of extrapolate from there that there's going to be more of a challenge to take into account the fact that there's the time factor, there's the question factor, and of course, you want to get as many correct as you can. And so, especially if people are not diagnosed with ADHD and taking these as prescribed, then, it's sort of a wild card, so to speak, such that, they don't exactly know how they're going to perform going into it, if that's a decent way to put it.
Okay, so let's get into some of the supplements that are, there's all sorts of stuff that gets thrown at us, all kinds of advertising that says, oh, hey, you could take this amazing focus, this homeopathic, this natural set of supplements that's going to help you focus. There's a ton of those things out there. Red Bull will give you wings. You've got people taking B12 shots to try to help themselves have more energy. So let's go through some of those rapid fire and just say, hey, does this have anything to it as far as your ability to perform, especially in a high stakes situation like a GMAT exam? Does it help mental performance? Let's start with something that's, I think, harmless. So vitamin B12, megadoses of B vitamins, is that going to do anything for you?
So the short answer on that is, if you find that you're deficient in vitamin B12 and those related vitamins, then it's worth talking about with your doctor. But, and just to kind of add to that, if you notice cognitive symptoms that haven't necessarily been diagnosed as something like ADHD, then you might go to your doctor and get checked out. But if your levels of vitamins are intact to begin with, then this is not an upgrade at all.
Okay, so Ari, you just said if you're seeing cognitive symptoms and it's not something that's been diagnosed, like dyslexia, ADHD, something like that, it seems like you're suggesting that there might be something physical things that can affect your cognition that your general doctor might be able to check out. Can you give us a sense of what sorts of things those might be, and what's your signal to go and talk to your doctor if you feel like your brain's not working the way you think it should?
Yeah, that's another great question. So, One of the things that people often describe is something like brain fog, or what I might call mental fatigue. And of course, there could be a whole host of factors that explain why somebody might be feeling just kind of sluggish, both mentally and physically. Could it be lack of sleep, or it might be something like anxiety or extreme stress, depression, or you're just not feeling well on a given day. So there are a lot of factors that can impact one's cognitive functioning. Doesn't mean that it's always going to be ADHD, but I would say that if it's something that persists for some period of time and it's making you concerned or a loved one concerned, then absolutely go to your doctor and see what they suggest in terms of getting worked up for it.
Because it could be something that's more psychological, something along the lines of depression or anxiety. Mm-hmm. But I think you're also suggesting it could be something with more physical, some sort of, vitamin or mineral deficiency or some other sort of issue processing nutrition.
Right. And so in clinical practice, actually, quick anecdote is that there's a lot of people who I have seen in the past who tend to need like a whole blood panel, just to kind of get a sense of where they're at physically and like a regular physical exam. And this is in young, seemingly healthy people too. So it wouldn't be shocking to me if somebody thought, you know what, I'm just feeling fatigued and let me go talk to my doctor, and they tell you, oh, you know what, something like your vitamin D3 levels are low. So based on where you live or, how much time you spend inside versus outside, something like that could change. So it's worth looking into if it raises any sort of flag, yellow flag, red flag, any of the above. But the main point here is that there are multiple factors that can have an impact on your cognitive functioning besides something like ADHD.
And to add a couple more to your pile, we've seen students get diagnosed with somebody who had low cortisol levels, as it turned out. And the doctor suspected very strongly it was rooted in a gut microbiome problem. Mm-hmm. So there ended up being a whole protocol around, essentially rebuilding the gut microbiome for this individual to help the hormone levels be back to normal so that they had enough energy to focus in the right ways. We've seen that. We've seen people get diagnosed with sleep apnea, didn't realize they had a sleep problem.
Yeah, that's a big one.
So any number of crazy things where if you're tired and you're sluggish, it doesn't need to be ADHD or dyslexia or anything like that. So all sorts of interesting things physically can lurk in there.
Yeah.
Getting back to some of those supplements, what about omega-3? So we hear about that as something that can help your brain. Is there any evidence for that?
Yeah. So omega-3s, that's another hot button topic as of late. And these are very reasonable to take for general overall physical health. But it is not necessarily something that is going to immediately have some sort of noticeable positive impact on test performance. So if you start taking it today and you take the GMAT next week, unfortunately, I don't think it's going to make a huge difference for you.
What about caffeine? So I've seen a couple different variants that involve caffeine, obviously just caffeine. There's caffeine and L-theanine is something some people swear by that particular combo for brain function. So is there anything to those?
Yeah. So we all know that caffeine can improve alertness, right? However, there's a threshold that we have to be mindful of, because if you have too much of it, then things like sleep are going to be impacted. You're going to feel more jittery. You're going to feel like your heart is racing out of your chest. You might feel more anxious too. And, there's all sorts of misinformation, unfortunately, out there about like what is a good amount of caffeine to have per day. So again, like the vitamins and the omega-3s, this is not something that's going to, boost up your IQ by 15 points right before the GMAT. But, certainly in moderation, it does help with your alertness. And as for the L-theanine, some people actually use this in combination with caffeine to try to reduce some of that jitteriness that might come out of just the caffeine. So there's a little bit of evidence there for helping with attention, but importantly, it's not a treatment for ADHD or anxiety. And so it's really not going to do much for you for the test.
So it sounds like there's a little bit of evidence that, so if you take caffeine, obviously most of us drink coffee, tea, energy drink, something. Our advice usually to students is, hey, on your test day, don't do anything radically different. We've seen people say,
oh, yeah.
Well, if a little caffeine is good for me in my mock exams, I'll have twice as much on testing. It'll be great. And then they're shaking so hard they can't press the buttons. Obviously, there's a limitation to that. Take it easy. Don't do anything too differently. It sounds like what you're suggesting about the L-theanine added to it is that counteracts some of the jitteriness. So you're ideally getting the alertness without the jitters that come alongside it. But it also sounds like that evidence isn't terribly strong that really makes a difference in terms of performance.
Right. And that's the bottom line there. So just there's the fact that there isn't a ton of evidence to suggest that this is going to optimize your test performance on that day. But also speaking to just what you said, Charles, about how you shouldn't change anything going into a test. I just want to reiterate that is incredibly important, very, very important, because you don't know what's going to happen. Like, what happens if you drink double the amount of coffee and then you end up having to run out to the bathroom several times, right? And you're kind of eating into the time that you have to take. So, if you're going to use caffeine or L-theanine or any of these other things to just kind of help put you in a mindset, then I would absolutely recommend trying it sometime before the test, just to see how you physically respond. Do not do anything new the day of.
You probably want to do it on all of your mock exams leading into the test, ideally, and get that routine down. If there's something like this that you think does help you, then get used to using it every time. And that way, when you get to exam day, it's going to be the exact same.
And don't overdrink caffeine or overconsume caffeine, because at some point, L-theanine is not going to be able to help with that jitteriness.
So taurine is another one that we hear a lot, tons of marketing around it. It's one of the ingredients in Red Bull. I think it's gained some traction as kind of separately as a supplement that helps performance. Is there anything to it?
Taurine, yeah, this is another hot button topic. The boost that people are getting from taurine is usually more about the fact that these drinks have a ton of caffeine, a ton of sugar, and it pretty quickly after ingesting it, gets you feeling really wired. So it's that kind of stuff that's having the impact on your alertness and focus, if you want to even call it that. More so than being a true medication that is acting in a cognitive enhancing capacity. So the reviews on this type of stuff, it's more about the caffeine and the sugar, plus the taurine, what it does to your heart and your cardiovascular system, that is sort of more concerning than trying to use it as a booster for your test performance.
So concerning how?
Concerning because mixed with the taurine with all the sugar and with the caffeine has the potential to increase your heart rate quite a bit, which might make you feel much more anxious and almost panicky, like you're having a panic attack. And if you're anxious and panicking, then there's basically no chance that you're going to be able to focus on the test. And so it's going to kind of cascade from there, and not in a good way.
Okay. So unless again, some people, personally, I like drinking Red Bull before I take a test, but I'm arguably trying to ramp up my anxiety. Now, if you're a test taker and you are in the habit of drinking an energy drink and it works for you, okay. But I think what you're suggesting is, well, taurine isn't really going to do anything to really help you. If anything, when you add it to the caffeine and sugar cocktail and some of the other ingredients, it's more likely to cause anxiety than it is to improve performance.
Yeah. Yeah, and I'm sure that test takers have probably heard of like almost like this bell curve where enough anxiety is good to a point, but then once that threshold is crossed, then it can very, very quickly kind of take you in that other direction where your performance drops off because of basically what's going on physiologically for you. So it again brings me back to thinking about if you're trying to kind of optimize your mental state before a test, the best way to do that is to either, practice the way that you're planning on doing it on the day of the test, and not or always try to get a decent night of sleep the night before.
Okay, so I keep reading about seeing ads for nootropic blends that help your focus. Seems like the ingredients vary a little bit, but it also seems like a massive industry. Is there anything to them?
To be honest with you, the rule of thumb in the way I think about it, and probably a lot of healthcare providers do, is to be careful. Just be careful, because these often have a ton of different ingredients in them, and the marketing for these products can sort of get way ahead of the evidence for their efficacy. And so, if you are going to look into some of these, please, make sure that you're looking at what's actually in them and making sure that that it's safe for you to take. And because inevitably what happens is that if something is put out on the shelves for over-the-counter use, the FDA is not really weighing in on the safety and efficacy of those things. And, like there are things out there, which I won't name names because I'm not here to disparage anyone, but there are things where they're like, oh, this is going to increase your focus by 1,000,000% or whatever. And then you just look on the back and see that all the ingredients in there can be found in your standard multivitamin. So the bottom line here is please be careful.
Okay, so bottom line here. So we just ran through a whole bunch of different supplements, and it sounds like what we all want, what I want to hear you say, Ari, what I would love to be the case is that you could say, hey, everybody, if you take substance X, substance Y, substance Z, there's a body of evidence that suggests it will help your mental performance, particularly on something like a reasoning task, a standardized exam. It sounds like what you're saying is there might be things that can help a little bit. No harm in omega-3s necessarily, right? That's good for your overall health. B vitamins, not bad for you. If you have a deficiency, they can help you. But it sounds like what you're saying is where the research on these things has gotten to is there's really nothing that consistently shows an enhancement in cognitive performance. Is that fair, or am I taking that too far?
No. That's completely fair. Yeah, no, it's... I would think that if any of these things, especially the ones over the counter, these supplements, if there really was a good body of evidence to suggest that they are safe and that they can actually increase one's scores, let's say, on these standardized tests, then I would venture a guess that most people would be taking them. But because most people are not taking them, or maybe they're taking some of these things, but for general health purposes, that it's because the research has not clearly said to us, oh, hey, I'm good for test taking. I'm going to make you get 100% on this test. So we don't have that evidence. I wish we did, but we don't.
Me too, because if we did, I'd be giving these to our students like it's candy.
Yeah.
Instead, we just tell them to get a good night's sleep and get some exercise and take care of their bodies, which is a lot less exciting. Yeah.
And if you are somebody who has a history of something like depression or anxiety or even ADHD, then, whatever medications that your doctor is prescribing for you, I would say take those as directed and, take care of your general health. Those, in addition to solid preparation, are going to get you further with these tests.
Okay, one last category of drugs I'd like to talk about. So beta blockers, other treatments for anxiety. So one of the things we see from students all the time, anxiety is just a killer especially on the GMAT. Just the way the test is designed. I think about 70% of GMAT test takers struggle at least a little bit with anxiety on test day, enough to really make their focus a little bit weaker. So beta blockers, how do those work? Is that something that can help? Who might benefit from them?
Yeah, so the core message here is that beta blockers can be helpful or useful for the right person. But in general, they're unfortunately another thing that's not a performance hack for people. So, anxiety, as we sort of hit on a little bit before, anxiety in moderation is good for, getting into the test, beginning it, and being on point, and locking in your focus. But as we know, if there's too much anxiety, then things can drop off. So what beta blockers like propranolol, which you may have heard of, can do is they're going to directly reduce the physiological symptoms. So we're talking about the muscle tension or the shakiness or the racing heartbeat. They're going to put your body in a calmer position. However, what they don't do is teach you the material. So you still have to know all of what you need to know beforehand. All the stuff that Charles teaches you in terms of what goes into good test prep. They're used for performance anxiety, but they're also another class of medications that are not cognitive enhancers.
Well, reducing the anxiety sounds like a huge thing for a lot of people, though. And I guess the question I would have is, for whom does that work? When is the anxiety significant enough that looking into something like beta blockers is worth doing?
Yeah, good question. So if you're somebody who, let's say you have a history of feeling panicky, like you're sweating or you're shaking or your heart's racing when you're taking tests, or even the one common example that people use is public speaking, for example, then these medications, these beta blockers, can be good for that. However, what they will not do is treat your anxious thoughts. So there's a big difference here. We're talking physical anxiety versus mental anxiety. And so the people who are going to benefit from these medications have physical anxiety and or mental anxiety. But if you're somebody who has just kind of a lot of worry and carries a lot of stress around, the beta blockers are not going to help for that.
Okay, so the distinction there, so I think the way a lot of GMAT test takers experience anxiety is it often is in the form of those negative thoughts that drift in. So it's, okay, I'm trying to focus, I've got a reading comprehension passage in front of me and it's 3 paragraphs long and I got to read this thing. And meanwhile, you're thinking, oh, wow, what if I run out of time? What if I do badly? What if I don't get into Harvard? What if my boss judges me because I have to take it a second? Whatever. I mean, all these things can come into your head. Yeah. The beta blockers aren't going to help with that noise in your head, the distracting thoughts. What it will help with is if your heart's racing like crazy and you start to kind of get this, almost the feedback loop between your brain starting to lock up and your heart rate going up. It sounds like it's going to help with that physical manifestation, bring your heart rate down a little bit. But those distracting thoughts, if they're still there, the beta blockers won't help necessarily.
That's exactly correct. Yep. Yeah. They have a very specific thing that they can do for people. And all the worrisome thoughts that constitute something like generalized anxiety, unfortunately, they're not going to make those go away.
And the one thing I will share, I've seen a few students who've gone down the road of trying beta blockers. Some have had good experiences with it. Some people with generalized anxiety disorders. We've seen people who say, yeah, I take beta blockers. It really helps. Feel my heart rate go down a little bit. It's easier for me to lock in. Typically in that situation, they also need a lot of work on the psychological side of things. And it's learning to live with those distracting thoughts or learning to let them pass through. Often mindfulness coaching or something like that helps them. But the beta blockers sometimes play a role. I've also seen students who complain that beta blockers make their brains feel fuzzy. And I'm not sure if that's something that you see in the literature or that comes up in any of the clinical trials, but I've heard that anecdotally a couple of times. And I don't know if that's just a couple of quirky people or if that's something that's common.
Yeah, so they are known to cause like sedation type effects in people, because if you think about it, if your heart's beating a mile a minute and a beta blocker is able to calm that down, then it's not just working on your heart rate, it's getting to your brain too. And so the whole like calming effect is extending throughout your whole body. And so that's why it's very possible for people to feel foggy or just, let's say, unfocused after taking something like a beta blocker.
Okay, so I'm sure there's some people listening, many of whom have probably already stopped listening or watching because we've said, yeah, a lot of these supplements don't have a ton to offer you cognitively.
Right.
So there's some people who want an optimization or looking for something that might help. There's a second group of people, I imagine, who are watching or listening who go, I feel like something's different about my brain. And I feel like I watch people around me who are at work or they're working on the GMAT or the GRE, or people around me when I was in university, and they don't seem to have the same struggles I have. Mm-hmm. And I don't know what my struggles are. I don't know what to call them. What would you say to folks who are listening to this and going, yeah, something feels different, but you guys didn't answer my real question, which is, I don't know what to do about it. What would you say to those folks?
Right. And what I would directly say to those people is trust your intuition. Because, in clinical practice, when you get in to see someone like myself, who does cognitive and psychological evaluations, then that's what we're there to help you out with. If you've got some sort of suspicion or concern, or a loved one does, then it is 1,000% worth thinking about getting an evaluation with a specialist, because there are all different sorts of factors that we can talk about together and that we can think about and analyze some data too, to figure out what is actually going on, if anything. Specifically, is it a diagnosable condition? And if so, what then do we do about it? Because, it's something where somebody can say, oh, you know what? I have just a ton of trouble focusing, and so I must have ADHD. But in just like general practice, that may be the case, but it also may not be the case. Somebody might have trouble focusing because they're not feeling well, or there's something off with their blood work, or because they're anxious or depressed even. So what we want to do in those types of situations is kind of dig in, like really get to the bottom of it and uncover all of the factors that might be explaining your experience.
Okay. All right. Can you say something briefly about accommodations too? Because we hear a lot of people kind of say, yeah, I think I have ADHD, but it's okay. I work through it. I'm used to dealing with it. Why is it important to pursue accommodations, and what are they exactly?
Yeah, it's important to pursue accommodations because at the core of it all, accommodations don't mean you're like trying to cheat the system or find some sort of loophole. Accommodations, in the way that I know I think about it, and I'm sure you do as well, Charles, is a way to even the playing field, right? It's a way to create equal access, because what's really happening, or I should say, what the test makers intend is for their tests to test out your actual knowledge. So whether that's math or reasoning or reading comprehension, whatever it might be, that's what they want to see. But in many cases, people who have significant anxiety or depression or autism spectrum or ADHD, what these tests are unfortunately detecting more readily are those symptoms, are those concerns. And so that sort of inherently makes the playing field very uneven. So the reason why people would want to apply for accommodations and again, not just for something like ADHD, is because you, like all of your other peers who are taking these tests, have the right to be put in a situation where you can actually show the testing boards your knowledge and not just show them that you have these symptoms that hold you back from accessing your knowledge in an appropriate and equal way to other people.
And functionally, just in case somebody's listening and going, what is this accommodations thing? It could be any number of things: a separate testing room that's quieter, often extra testing time. And again, they're all designed to make things more fair so that you can show your GMAT reasoning abilities sort of independent of whatever condition is maybe causing something different in your ability to focus. Mm-hmm. All right, Ari, is there anything else you'd like people to think about or understand about this whole process?
So yes, there is something I would like everyone to think of too. The exam you're preparing for might be the reason that you end up seeking an evaluation or seeking mental health care in the first place. But the diagnosis and all the other things that you learn about yourself during that process can matter for the rest of your life. And so I just want to kind of leave that open to people to think about and ponder.
All right, Ari, so if anybody listening or watching wants to learn more, get a diagnosis, maybe pursue accommodations, where can they find you?
Please visit our website. It's www.collegepsycheval.com, and we're going to get you a comprehensive evaluation done very efficiently, and we're going to help put you in the best position possible to get your accommodations that you deserve. Just don't hesitate to reach out to us. We love talking to people.
Thank you so much, Ari.
Thank you.
Thank you for joining us for today's episode of the Random Guest Podcast. Huge thanks to our guest, Dr. Ari Hall of collegepsycheval.com. If you enjoyed this, help other people find us by hitting the like and subscribe buttons. If you like a little bit of video with your podcast, you can find us on YouTube on the GMAT Club and GMAT Ninja YouTube channels. If you prefer audio only, you can find us on Spotify, Apple Podcasts, Amazon Music, or wherever you get your podcasts. And if you want to know more about GMAT Ninja, including our new course and our test anxiety resources, you can find us at gmatninja.com. Thank you so much for watching and listening, and have fun studying.